The worldwide death toll from the coronavirus continues to grow as it's now deadlier than the SARS outbreak of 2003. Welcome to this special edition of Full Circle. I'm Anderson Cooper. There's still a lot of unknowns about how the coronavirus has spread so fast. We'll talk to Dr. Sanjay Gupta in a moment to answer all your questions about the virus. But first, a little about what we know. Reports of what we now know to be coronavirus were detected in Wuhan, China in December of this past year, and in just a few short months, it spread across China and is starting to spread around the world. Confirmed cases across Asia, Australia, Europe, and in the United States. Fears of a global epidemic are very real, and as the situation grows, we ask for your questions, and we're going to try to answer as many as we can. Joining me right now is CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay, thanks for joining us. So a viewer wants to know, how do they test a person to see if they have the virus? How long after the test are the results available?
Yeah, well, this was one of the big breakthroughs with regard to this outbreak. They were able to develop a test. In this case, they can do something as simple as a nasal swab even. They can test blood, whatever it might be. But when they're doing this test, they're basically looking for the presence of the what's called the RNA of the virus, and then analyzing that RNA and seeing if, in fact, it is this coronavirus. It can be done within a few hours, which has really been a big deal as far as these screenings go. You can imagine if someone comes in, the test results take a few days, you don't know if the person has the virus, they could be inadvertently infecting other people. Getting the test done quickly with this very recently developed test has made a big difference.
How long does, another viewer wants to know, how long does the virus stay in your system?
Well, that's a good question, and we don't know the answer. You know, when we call this a novel virus, a new virus, I guess it's sort of obvious that we've not seen this virus before, but it also means that we can predict certain behaviors of this virus, but we're not entirely sure because this is a brand new virus, certainly circulating in the human population. They think it's, up to a couple of weeks that the virus can stay in the system. It's part of this incubation period between the time someone gets infected to the time they develop symptoms, about 2 weeks. So roughly around that time, they think the virus will stay there.
So if you're infected, this is a question I just had based on what you said. If you're infected, how long does it, and you haven't gotten symptoms yet, if you get the test, would you test positive for it? Or does
You can test positive. First of all, the only people that should be getting tested, to be clear, are people that are considered at risk for some reason, have traveled to that part of the world, have come in contact with someone who is known to be infected.
Right. If someone in the United States just now gets a cough, they don't necessarily need to think they have the coronavirus.
No, they don't need to think they have the coronavirus. And what's happening a lot in emergency rooms is that people are showing up concerned, maybe understandably concerned, and wanting to be tested for coronavirus, and they're being told no. And the reason they're being told no is that they're at very low risk for this actually being the case for them. So they don't want to start this sort of random act of screening people for symptoms that are most likely a common cold or the flu, which are certainly much more common in the United States. But when you're looking at this particular test and you think about how long afterward, if the incubation's up to 14 days, it can be longer than that perhaps, but 14 days is what the public health officials think it is now. Everything sort of circulates around that number.
And someone else wants to know, how do people die from the coronavirus? Do they all get pneumonia?
Yeah, no, it's interesting, and not everyone gets pneumonia. There is a certain percentage of people get pneumonia who are more likely to have weaker immune systems, have some sort of what we call compromised immune system. Think of this, the virus gets into the body. The body is the host at that point. The virus needs the host. If it can, without being killed off by the host's defense systems, it'll start to replicate within the body, replicate within the cells of the body. And at some point, it may start to overwhelm the body, affect many different organs. One of the ways that commonly, people do die from this is because of respiratory type things, such as pneumonia, such as something known as ARDS, ARDS, which is acute respiratory distress syndrome. But that's not the only way. So, it's critical to think about the virus potentially affecting the entire body.
We've got another question. If somebody dies from the coronavirus, is the virus still going to maintain in that person, or is the virus going to die with him?
The virus is basically going to die with the person. I mean, there are certain pathogens that can live after the person or the host in this case has died. But with this virus, they really need a host. The reason they're even going into the human body is to find a host when that host is no longer living.